I'm pleased to be joined here today on Health Beat by Corinna Hansen, a nurse practitioner with Faith Regional Physician Services Norfolk Family Medicine, and we're discussing antibiotics. And Corinna, what are antibiotics and what are they used for?
Antibiotics are medications that are they're used to treat bacterial infections. They work by killing the bacteria in the body. They can be very helpful. However, sometimes they get to be used a little too much, even if they're not needed. This can cause antibiotic resistance. This happens when the bacteria that is exposed to the antibiotic changes and the antibiotic no longer works on that bacteria. In that instance, the medication doesn't work and the infection doesn't clear. Antibiotics are very helpful in treating certain bacterial infections such as strep throat, pneumonia, or a bladder infection. They are not good for a viral infection such as that common cold, influenza, most sore throats, sinusitis, or bronchitis. Even though they don't work on a virus, patients often believe that they do. And this is tricky because maybe the patient took an antibiotic for a viral infection and got better. The problem is that the patient would have gotten better whether or not they took this medication.
Sure.
So when they get better while taking it, they believe that that's what treated the condition. The reality is the antibiotic had nothing to do with it. You should only take an antibiotic if it was prescribed for you. Never take someone else's medication. Never take an antibiotic that was prescribed for a previous illness that you didn't take all those pills for. Doctors work really careful to pick which antibiotic should be used for that particular infection. Not all antibiotics work on all infections. Patients can do their part in helping prevent antibiotic resistance. They should try to not pressure their doctor if he thinks that they don't need to take an antibiotic. If you are prescribed an antibiotic, you should take all of the medication as directed. Never skip any doses, and don't stop taking it unless you talk to your doctor. And don't give your antibiotics or any medications to anybody else if that medication was prescribed to you.
Yeah. All right. Well, thank you so much. Appreciate that. And that's Health Beat, brought to you today by Faith Regional Physician Services.